So we're going to talk about some other respiratory and respiratory related complications. Two of these are actually complications of oxygen therapy and positive pressure ventilation. And then another is actually connected to the neurologic system. So we're going to start with bronchopulmonary dysplasia. Remember that when talking about respiratory distress syndrome, I said that they use ventilators only when the baby is unable to ventilate themselves. Positive pressure ventilation and oxygen both can cause excessive oxygen, can both cause damage to the alveoli over time. So this is a long-term complication. The damage to the alveoli is permanent. So in order to reduce that risk, they try to use nasal CPAP prior to moving to ventilation. These babies may actually end up needing oxygen longer term because they've had alveolar damage, so they're less able to exchange gases long term. Retinopathy of prematurity is also caused by fluctuations in oxygenation. It's caused by vasoconstriction and hypoxemia to the retina, possible retinal damage, but hyperoxygenation and fluctuating oxygen levels actually tend to make this more likely to happen. So the signs, they're going to be, an ophthalmologist should be examining the eyes of preemies who are getting oxygen regularly. What they see is progressive vascular growth. Okay. Management, we want to prevent preterm birth. We want to use oxygen judiciously. We used to just do 100% oxygen on everybody. We thought the more the better. But we realize that excess oxygen is causing damage. And so we just maintain oxygenation to maintain SATs above 94. We want to also maintain stable oxygen saturation as much as possible. So prevent those episodes of hypoxia, screen infants that are at risk. If an infant develops this, there are a couple of things they can do to try to decrease the excess vascularization, and they can do surgery to try to repair a detached retina, but we really want to try prevention otherwise. Apnea of prematurity is persistent apneic episodes, bradycardia, oxygen desaturation, cyanosis. So the baby forgets to breathe, basically. It's caused mostly by an immature neurologic system, but if the baby is anemic, that tends to increase it. If they are acidotic or hypoglycemic, that tends to increase it, and cold stress. So we really want to make sure that everything else is working the way it should be, or we've maximized everything else so that they're not taking energy away from breathing. So we want to manage contributing factors. During an episode of apnea or bradycardia, the baby's usually stimulated, usually some kind of tactile stimulation. We want to suction the mouth and nose. Babies that have persistent apnea and bradycardia may actually get a caffeine drip to maintain those. They may also use CPAP as needed. Okay, in the next section, we're going to talk about persistent pulmonary hypertension. And we've actually mentioned it a little bit a couple of times, but we're going to talk about what the effects of that look like, and then we're going to talk about pneumothorax.